So oligoprogression. Now, so we'll continue to talk about oligoprogression. And this is really why I think it's so critical for us to develop biomarkers. In the figure on the left, you see 5 patients that had the same EGFR mutation, yet they had widely disparate outcomes when it came to progression-free survival on osimertinib. One could say that there were many different reasons: the presence of different co-occurring mutations, the different host biology, meaning your immune system behaved differently, responded differently to the therapies. And so we are all, as a group, trying to tease out these issues. But it's also important for us to continue to add radiation in an oligoprogressive scenario where you've been on drug for a while and then you get local therapy. Remember, the previous patients all received radiation at consolidation, and a lot of them continue to receive radiation at progression as well. So it's almost like two situations. But ours was one of the first studies that was done in 2014 in collaboration with the University of Colorado. It was a single arm study that combined an EGFR inhibitor with radiation to show that it was safe and to show that it was potentially successful. And how do we say that it's potentially successful? These patients, back when we did the study, had very few subsequent line therapy options. They had failed multiple lines of therapy, but despite having failed multiple lines of therapy, their overall survival after our treatment was 20 months, and their median progression-free survival was 15 months, which was, at that time, we felt extraordinary. And it's, this is played out in randomized studies as well. And this is Dr. Tsai's study from Memorial Sloan Kettering, where they randomized patients who were oligoprogressing. Again, progressing in limited sites of disease. They randomized them to radiation versus continued systemic therapy, subsequent lines. And the patients that received the radiation had a better progression-free survival, had a better overall survival, and it was actually correlated with these line graphs. I mean, these graphs with these lines that you see in the middle, i.e. circulating tumor DNA. So the circulating tumor DNA was giving us a prognostic and potentially predictive model of whether these patients would benefit or did benefit from their local therapy. So it's still a work in progress. This study that's looking at radiation and oligoprogressive non-small cell lung cancer patients is being tested in a much larger patient population that includes EGFR and ALK mutated patients, and we're really excited to see what the findings are of that.